และสวัสดีค่ะ Good afternoon. Today is Wednesday, the 27th of October, 2021, and this is the English language summary of the daily press briefing by the Center for COVID-19 Situation Administration, or CCSA. Let me start off with a summary of the numbers that we keep daily tabs on. The vaccination progress for you is that since February 2021 and since yesterday, we administered 812,009 doses of the vaccines. This is increasing the accumulated number of vaccinations to over 72 million doses. As of now, approximately 56.5% of the population has received at least the first dose of the vaccine, and 40.4% have completed their second dose. The general situation, as you can see from the slide on the screen, new confirmed cases today are recorded at 8,452 cases. This brings the total accumulated cases to 1,875,315 cases. Of these, active cases account for 98,096 cases, of which 2,355 are in critical condition and 534 are unfortunately on ventilators. New recoveries are outpacing the new cases at 8,449 cases, which brings total recoveries to 1,758,297. New fatalities are at 57, which represents 1.01% of the total number of infections. Unfortunately, that has brought our accumulated total of fatalities to 18,922 cases. Some key observations we'd like to share with you today, as we have in the past, are that in the top 10 provinces experiencing the infection rates, Bangkok, unfortunately, still has the highest number of cases, and that totals for you today at 859 cases. This is followed by a very high number in Songkhla, Pattani, Yala, Chanthaburi, as shown on the screen. To give you an overview of the comprehensive situation in Thailand, many provinces, as was mentioned just now in the Thai language briefing, especially in southern Thailand, are witnessing a rising number of new confirmed cases, which includes in particular cases in vulnerable groups, such as the elderly. This was just detailed in the Thai language briefing. And once again, everyone is encouraged to receive their vaccination so as to prevent the number of infections that we are seeing in the south. However, overall, the number of patients in severe condition and fatalities are on a downward trend. We hope to continue on this path as we begin and gear up for the reopening of the country on the 1st of November. There are naturally a number of queries, and we thank you and thank each and every one of you for sending us your questions, which we are monitoring daily because it helps us to prepare for the weeks ahead together. Some of these questions that we have received are very specific in nature, so we would advise you to contact the nearest Thai embassy in your location, and they can help you with specific cases. For those questions of a general nature, we aim as best as we can to respond to them here. So the responses that we are preparing for you today are those that relate to hotel refunds. And this is as it relates to the transitioning from the COE system to the Thailand Pass system. Regarding the issue of hotel refunds, for any 7-day booking that international travelers from the 46 countries and territories exempted from quarantine have made before the commencement of this quarantine exemption scheme, you are advised to contact the hotels where you made your reservations directly. The government has already notified and encouraged these hotels to consider refunding your payment, but please do contact them directly. Let me now turn to developments with regard to the Sandbox Scheme, and very soon we will have a slide coming up for you to show you where further measures have been eased with regard to the curfew. So you see on the screen there are specific areas mentioned in the 17 provinces that are under the Sandbox Scheme where curfew will be lifted. And that begins from 2300 hours of the 31st of October 2021 onwards. Again, these provinces are in the pilot tourism plan, or the so-called Sandbox Scheme, for Thailand's reopening campaign. They have also been referred to, and you may have seen this in other news reporting, as the blue zone. Once again, let me underline that this Sandbox Scheme is separate from the exemption from quarantine scheme. So as regards the 17 provinces that are in the Sandbox Scheme, there will be no quarantine in the hotels for all international travelers by air, and you will be limited, of course, to the specific sandbox area for a specified time. Again, the no quarantine or quarantine exemption scheme applies to travelers from the 46 countries and territories who will have access to the entire country after taking the PCR test and waiting one night for the results. You may have also heard in recent days reports on the new Delta Plus variant. Yesterday, in fact, the Ministry of Public Health reported the first case of the Delta Plus coronavirus variant has been found in Thailand, which has caused a bit of concern as this variant could be more contagious than the Delta variant. In any case, we are keeping a very close eye on developments related to this variant, and at present, it is not going to affect the country's reopening plans, as so far only one Delta Plus infection case was detected in Thailand. And this is actually from samples of fully recovered patients, which were sent for random testing of genetic sequencing at the Armed Forces Research Institute of Medical Sciences. Again, we are keeping a very close eye on these and other developments. And for these and other reasons, the requirements we have in place for international travelers from the 46 countries and territories to present negative COVID tests, be fully vaccinated before traveling, and undergo another RT-PCR test and wait overnight, we believe will help to reduce risks to those around them and others in the country. In sum, and before I close, let me reassure our audiences listening at home and at work that we are keenly aware that both Thai and foreign travelers may continue to have many specific and general questions. Our embassies around the world have received guidance in clarifying your concerns as we transition from the COE system to the Thailand Pass system. The Ministry of Foreign Affairs, in fact, will continue to update this guidance as soon as any and all new developments are confirmed. So we advise you to please contact your nearest embassy, and you can also check in on some of the useful guidance that's being posted on their websites. Meanwhile, at this CCSA briefing, we will continue to respond as much as we can to as many queries as we can. That's all I have for today. Please stay safe, stay healthy, and enjoy the rest of the day. Thank you, and สวัสดีค่ะ